Good evening indeed, and many thanks for joining us here on Rwanda Television News. We hope you are having yourselves a productive week. Now, top of our edition tonight, these are our headlines. Medical experts say that excessive bleeding at childbirth is the #1 cause of death for women, and it's a problem that needs to be addressed. People living with diabetes and other loved ones with condition have noted that the importance of fighting depression and taking care of themselves is in order to live longer. Glad to have your company tonight, coming to you straight from the heart of Africa, Kigali. My name is Martina Abera. Now, people living with diabetes and others with loved ones with the condition have noted on the importance of fighting depression and taking care of themselves in order to live longer. Betty Mutoni has the report.
Over 23,000 children, adolescents, and young adults live with diabetes in Rwanda. And here are some of the people living with diabetes sharing us their experience.
In the beginning, it was really a difficult time because I had to perceive that change in my life as healthcare personnel were telling me that I'm going to change the lifestyle and in terms of nutrition, in terms of medication, and in terms of continuous monitoring of my blood sugar. So it was quite a hard time for me to perceive it.
Mine are very thin. Imagine a child of 15 years weighing 25 kilograms, the one for 19 years weighing 20 kilograms. So when they see their age mates, it makes them uncomfortable. They are kids who are always unhappy, never smile with others. Although it was hard for them to accept their new normal life of living with the diabetes, Iber noted that through the advice and care got from Rwanda Diabetes Association, he is a living example that you can live and achieve your dreams besides having diabetes, and is requesting the society not to stigmatize them.
Basically, I can start with the society. The society should know that people living with diabetes can live normal lives like other people without it, as long as they are given the medical care they deserve, and just they can live the normal life like other people, and they should be treated like other people without diabetes because they are still capable. I was telling you that I'm a living example.
Etienne Ingabire, the director of Rwanda Diabetes Association, noted that regardless their advocacy for the people with diabetes to different partners at both national and international level, they still face some challenges, as he explains.
The cost of medicine is very high. Even is 10% you pay on mutuelle de santé, sometimes you have to imagine someone who attend the hospital every month. To get 10% is not very easy for the people because sometimes they have no enough means to access the medicine. And also there is a problem to have enough materials to check their blood sugar. You imagine if you have type 1 diabetes, for example, you have to inject every day. And before you inject, you have to know your blood sugar. And if you know your blood sugar, you can adjust your insulin. And if you have no information about your blood sugar, you can take an amount of insulin, and sometimes you fall in hypoglycemia. This is a very big challenge, and also the mutuelle de santé cannot cover the glucose meter in the strips.
The executive director of Non-Communicable Diseases Alliance, Alphonse Barushimana, noted that raising more awareness on how to prevent and fight against diabetes can reduce the number of cases of people suffering from diabetes.
And we're mobilizing the community to avoid risk factors. And when we say risk factors, those are mainly four. First one is being active physically. Like when you are not doing physical activity, you are putting yourself to the risk of developing diabetes. We are advising people to not smoke and not drink too much alcohol, and again having a healthy diet. So those are mainly four risk factors. And again, for the bigger intervention in the community is to have earlier diagnosis, or even having a medical checkup to know if you don't have diabetes. It's a
Rwanda Diabetes Association is a legally recognized non-government organization founded in 1997 with the aim of improving the well-being of diabetes patients in Rwanda. Betty Mutoni, RwandaTV News.
Thank you, Betty Mutoni, for that report. Now moving on, 763 students concluded their bachelor's degree studies in the University of Technology and Arts of Byumba on Thursday. The university states that it focuses on the education that provides solutions to current issues faced by the state. Prince Manzi has the report.
The graduates are from the College of Education, Finance, Economics and Rural Development, and in the College of Agriculture, Forests and Renewable Energy. Some of them say that they are going to create jobs and find solutions to current issues of the state. We gained useful skills here, and we are ready to play our part in Rwanda's energy sector and also adding our innovations in preserving the environment.
It is beneficial to work in a field in which one has experience about. But when someone starts a business out here, it fails because of lack of skills. But for us, we might start with what we know and achieve a sustainable development.
The Executive Director of the Higher Education Council, Dr. Rose Mukankomeje, states that the country imposes on the economic growth based on education, and that is why universities should contribute to this. Some of the parents appreciate how the government gave all the children equal right to education.
This is a milestone because most of the children are studying in universities. There is no parent who cannot be happy with this.
We are happy for the changes in education, where even a child from a poor family can study in a good university and acquire such skills. The Vice Chancellor of the University of Technology and Arts of Byumba, Dr. Gilbert Monana, states that their priority is to provide skills that will help in solving the issues found in the country. For instance, like the Gihembe Mountain, we want to make it a productive mountain, but also performing there a research on the umuzeti tree that is used to generate olive oil. We want it to be a mountain that demonstrates the vision, proper land management, and at the same time a touristic and research venue. Bishop Zakamita Servilien iterates that they are expecting to improve the infrastructures, increase the number of lecturers, and focusing on more researchers. Ever since the establishment of this university in 2006, 5,589 students have graduated from it.
Thank you very much, Prince Manzi, for that report. Now, on to matters of the health. Medical experts say that excessive bleeding through childbirth is the #1 cause of death for women, and it is a problem that needs to be addressed. We have the report. Ahimana Martha is a mother who says she had serious complications when she was about to give birth. They gave me 6 pills to increase the contractions, and instead of the colon opening, the bladder ruptured. I waited impatiently, and the doctor finally decided I have to have an operation. Dr. Subira Manzi, who is 72 years old, has been a doctor for 40 years and an obstetrician for 33 years, a profession he entered because he feels that women's lives are of great value. He is currently the chief consultant of BES and Gene at King Faisal Hospital. He says that excessive bleeding is the leading cause of death for women.
Antepartum hemorrhage happens mostly in situations where the placenta, which is supposed to detach itself after the baby has been expelled. In this situation, the placenta separates from the uterus before the baby comes out. So the phenomenon which we follow thereafter is that the woman would bleed. And if nothing is done to stop that bleeding, both the fetus and the mother are under jeopardy. Jeopardy, it means that complications can lead to death. That's the most important cause of death or complications before the delivery. During the labor, which would be virtually the very same thing, except that this time there are contractions of the uterus which help to expel the baby out. Again, these conditions when you have the placenta separating from the uterus before the baby comes out, the delivering patient will bleed. And if you don't have time or means to stop that bleeding, complications can lead to death of both the unborn baby and the mother. Lastly, when the baby is expelled already, and that placenta doesn't come out timely or timelessly, the uterus, which doesn't contract to come back to the normal situation, will behave like an open wound and will bleed out. Again, if we don't have means of stopping that kind of bleeding, again, because this time the baby is out, only the mother will be jeopardized. So these are the 3 steps where we expect complications of hemorrhage before, during, and after the delivery.
Obstetricians and partners in the medical field gathered for the 8th annual meeting of their forum. Director of Global Programs at Susan and Thompson Buffet Foundation, Professor Sene Fiseha, points out that there are still problems that threaten the life of mothers.
Unintended pregnancies have declined by more than 30% in the last 20 years. However, despite these achievements, we still have a long way to go. Nearly 1/3 of women in Rwanda still do not have their contraceptive needs met, and more than half of pregnancies today in Rwanda are unintended. Of this, nearly 30% end in abortion, and each year, roughly 24,000 women and girls need emergency medical treatment from unsafe abortion.
Its CEO, Dr. Ngoga Eugene, says that improving the work they do would help preserve the health of mothers.
The theme was chosen in the context of the COVID-19 pandemic, accelerating sexual reproductive health and maternal health services amid COVID-19. Looking at different panel discussion, different topics to be discussed, I'm confident that at the end of the conference, we will be able to further understand what can be done to maintain high quality maternal health services and sexual reproductive health.
Currently, there are 112 gynecologists in Rwanda, from 10 in the last 10 years. Minister of State in charge of primary health care in the Ministry of Health, Dr. Tarsis Munga, says that the government is still looking for ways to increase the number of gynecologists and midwives.
Starting next year, we can provide scholarship for young people who want to adhere in the midwife department, and also for gynecology and obstetric department. So I want also to call upon gynecologists who are here. The burden is not here in Kigali than rural areas. So women, young girls, they are suffering in the rural areas because they don't have access to quality of services, because they don't have access to qualified professionals. So instead of moving from the rural to the city, so how can we now motivate people going down to address those issues?
According to the Ministry of Health, in 2021, out of 347,000 women who gave birth, more than 87,000 had a C-section, a process that is easily prone to complications during childbirth. Now, still on to matters of the health. According to Rwandan health institutions, preterm births account for 40% of fatalities among children under the age of 5. Pediatricians recommend skin-to-skin care as one of the most effective strategies to help children develop well and have a healthy life. Olive Nete has the report.
Blandine Nyumuhoza from Gasabo district gave birth to a baby at Kachiru Hospital at just 26 weeks. She says that she initially believed that she would lose her baby, but because of the medical attention she received and her willingness to follow the doctor's advice, the child is currently doing well. I had contractions before time. The doctor tried to stop the contractions, but it wasn't possible. I had to give birth. When they told me I was going into labor, I was terrified and worried I was going to lose my baby. He was born with 970 grams and was so small. He now has 2 kilograms and it has been 2 months and 2 weeks since his birth, and I believe he will be okay. A child is considered preterm if they were born less than 37 weeks and weighs less than 2 kilograms and 500 grams. These kids frequently experience infections, poor digestion due to immature intestines, and respiratory issues. According to pediatrician Dr. Ndaikeje Ariane Nina, the skin-to-skin mother care method assists in the growth of premature babies. When these preterm babies are exposed to cold environments, it can be very detrimental to their growth. Therefore, skin-to-skin mother care helps the baby to be warm in a short period of time. This method also helps when they are able to breastfeed, as this allows their intestines to open and develop the capacity to receive the milk. Additionally, the baby receives the necessary nutrients found in the milk by sensing the mother's affection through the skin-to-skin contact, and this stimulates the production of milk. On November 17, the entire world observed World Prematurity Day. In Rwanda, it was celebrated at Kibagabaga Hospital. The Director General of this hospital, Lieutenant Colonel Dr. Munyemana Ernest, and Dr. Chiza François Regis, who is in charge of the Department of Maternal and Child Health Programs in hospitals at the Rwanda Biomedical Center, emphasized the importance of ongoing communication between the mother and the doctor in order to lower the mortality rate of premature babies.
The first thing we advise expecting mothers to do is to visit the hospital as soon as they become aware of their pregnancy. By doing this, she can be followed up throughout the pregnancy and learn how the baby is growing in the womb, which makes it easier for us to explain to the mother how the baby is growing in the womb. It is also simple to follow up with a mother who experiences a problem during pregnancy and gives birth at the hospital. However, we also encourage mothers to work with doctors by adhering to their instructions because they play a crucial role in enhancing the health of the baby. We are increasing the number of materials needed when taking care of these premature babies in order to reduce the number of neonatal deaths and various problems these babies face.
According to the Rwanda Biomedical Center, 10% of babies are born prematurely, and 40% of deaths among children under 5 years old are due to prematurity. Olive Nete, RTV News.
Thank you, Olive, for that report. Now, in discussions organized by UN Women, calls were made to various stakeholders to put women in leadership positions in order to improve nutrition and family development. Adams Kwizera has the report.
The family of Mvutiye Jean Paul and Mukarusaga Dative is one of the model families in the rural sector. This is due to their cooperation as family. Whenever I have money, I buy food, and even when she gets it also, she buys. Meanwhile, we cooperate in all.
When we are about to prepare what to eat, he helps me as well. We would cooperate as well, even when preparing nutrition for our children, as even our children looks nice due to having good nutrition.
UN Women organized its Gender Dialogue series on the theme titled Placing Women's Leadership at the Center of Sustainable Nutrition in Rwanda. where they discussed measures to advance the adequate nutrition, as their representative in Rwanda, Janet Kim, explains.
Bringing all our efforts together to ensure that households across age groups, across various needs, everyone has nutrition that is adequate for their own needs. So that was the purpose for the dialogue today, placing women at the heart of sustainable nutrition.
The Rwandan Minister of Gender and Family Promotion, Professor Jeannette Bayisenge, notes that these dialogues helps in the implementation of gender policies.
Today we're discussing the role of a woman, not just see the woman as the one to be in a kitchen preparing food, but also the one to be engaged in decision making regarding the production of food, regarding the use of the produce from the household level, because it has came out that sometimes when there is a production at the household level, the produce, women don't have a say on how to use this, and it may end up going to the markets while children and the other members of the families are starving at home. So we need really to emphasize on the role of women in the leadership around the decision leading to the fight against stunting and malnutrition.
Rwanda has made an impressive growth in agriculture production over the past 10 years, yet food security and nutrition remains a critical challenge, and the country's intervention to solve it are guided by a gender-responsive sector strategy to empower women. Adam Squizera, RTV News.
On behalf of the production team, we thank you so much for sticking with us. Have a great night and stay safe.